my name is Carrie West.
I'm Michaela Holland.
I'm Stephanie Butler.
And I'm Ashley Smith.
And I'm Christian Rodriguez. We are here to propose a HRSA-funded grant for a veterans residential facility called the Healing Heroes House.
19% of traumatic brain injuries in the United States are due to combat deployments. In the year 2000, 357,048 service members had sustained a traumatic brain injury while in combat. In 2010, 1,725 service members in Georgia alone were diagnosed with a combat TBI. In South Carolina, there were 379, and in Florida, there were 2,383. Healing Heroes House is a facility to bridge the gap in services provided by the VA clinic and to reduce the comorbid diseases of TBI by providing clients with skills of managing daily life along with other skills that promote independence.
We are requesting $500,000 each year for 2 years from the HRSA grant. We are grateful for the generous donation of the residential location of our facility. Therefore, the majority of the grant allotment will be going towards quality staffing and their associated fringe benefits. Only 4% will be going to outside contracts that include pharmacists, labs, the internet, and housekeeping.
Here we have our flowchart that demonstrates our inputs, outputs, and outcomes. Some of our inputs are that the services will promote increased independence for our service members, and we will also be addressing behavioral concerns and barriers to social interactions. Our comprehensive program is going to be available to veterans, active service members, males and females, and they have to have sustained a traumatic brain injury. All of these beds will be available to the Low Country area from Charleston, South Carolina to Jacksonville, Florida, and we will have a total of 20 beds, 8 for female and 12 for male. Our primary outcomes are to provide individualized programming for our service members, to reduce the extinction of maladaptive behaviors, to stabilize the immediate needs and emotions of these service members, and to also provide community support. Some of our secondary outcomes include reintegration into society, to reach individual independence, to reestablish feelings of independence, value, and worth, and to also attract participation of community members in the Traumatic Brain Injury Support and Information Group.
The mission of the Healing Heroes House is to treat veterans with traumatic brain injuries who cannot receive the quality of care they deserve through their own insurance. Healing Heroes House is closing the gap in services by providing a specialized center that strictly treats veterans with TBIs in areas where treatment is not available. The ultimate goal of the program is to help each participant reach their highest level of independence, improve their quality of life, and obtain community inclusion. The goal is to reduce or extinct maladaptive behaviors to a level that can be managed in the least restrictive setting. The Healing Heroes House serves adult service members from all branches with traumatic brain injuries and possible alcohol and drug issues and/or physical disabilities. This will be located in the city of Savannah, servicing all of Savannah and the surrounding Low Country from Jacksonville, Florida to Charleston, South Carolina.
Healing Heroes House provides a residential community integrated rehabilitation facility. The Healing Heroes House is located downtown Savannah, Georgia, in a residential neighborhood. The Healing Heroes House is licensed as a certified nursing aid with a 20-bed facility. Planned capacity of 8 females and 12 males. Planning team will provide qualified staff that utilize a team-based model of intervention. Implementation of programs will be provided with evidence-based treatment programs.
All direct care staff complete training requirements in accordance with DHS 83. The licensure will be Commission on Accreditation of Rehabilitation Facilities. We first have our program director. They ensure that VRF and mission admission criteria are met and that if admitted, we are able to meet and provide for the individual's needs. Under the program director is the administrator who determines the appropriate placement in relationship to treatment and expected outcomes. They are also with the director of admissions who develops contracts, verifies funding, and streamlines the admissions process. Under those two is the unit program coordinator. They are on the premises daily to ensure that safe and adequate care, treatment, services, and supervision are being provided to all participants. Under the unit coordinator is the nursing staff. They review the medical history to determine nursing care needs, reviews the medical regime, assesses their capacity for self-care, equipment needs, pain issues, etc. Next is the psychology team. They review the record to assess behavioral and mental health issues. Next is the case management team. They are based on the initial assessment. An individualized service plan is developed for each participant by the case manager and therapist. Finally, under everyone is the other staff. These are qualified resident care staff, awake staff in the facility at all times.
Implementation of programs. All activities are individualized for each client's needs. We will be teaching and assisting clients with meal planning and learning how to eat with a trach tube or other impairments. We'll be setting up weekly chore schedule, home safety, laundry and clothing care, organizational skills in a home environment, and budgeting and comparative shopping techniques. Understanding community transportation systems, community mobility skills, as in crossing the streets, monitoring traffic, map reading and following directions, understanding various types of insurance, taxes, looking for appropriate living situations, and emergency procedures in the home and community. We would like to focus on developing and identifying leisure interests and vocational or volunteer activities. We'd like to develop an awareness of what is going on in the world around them. We'd like to develop appropriate social behavior, interpersonal communication, to develop skills in identifying both the content of the message and the feeling component, and to develop skills in identifying and interpreting nonverbal communication to aid in community inclusion. We will plan and select nutritious food items for meal planning and preparation, to identify 4 basic food groups and to identify healthy snacks. We will also manage stress and anger management groups to identify healthy ways to deal with daily stressors and self-manage anger.
Evaluations for every individual's TBI symptom will be done monthly. We will also be conducting care plan reviews quarterly to review clients' goals and program services. We will also be asking for self-report evaluations on an ongoing basis. These evaluations will determine the client's level of satisfaction, the quality, quantity, and variety of food that is being served, the adequacy of his and her living quarters, and whether or not the patient feels safe and comfortable in the facility. We will also be asking for family members to be conducting these same evaluations.
In order to establish sustainability, we will be working with collaborative partners such as local physical, occupational, and speech and language therapists, as well as the Department of Veterans Affairs and other veteran service organizations, Savannah Technical College for GED assistance, as well as support groups for Alcoholics Anonymous, Narcotics Anonymous, and traumatic brain injuries. We will also be integrating community resources by providing community referrals at the time of discharge.
A few of the limitations that we've encountered has been the lack of accurate data to reflect the true needs of individuals suffering from TBI and other associated psychological disorders. Difficulty of diagnosing TBIs, which many of those who previously suffered a concussion or mild TBI have not been properly diagnosed and therefore left untreated. Also, a small size of facility, only able to offer services to a small portion of the total estimated number of veterans suffering from TBI in the greater Savannah area, as well as difficulty reducing cognitive symptoms such as attention and concentration, processing and understanding information, memory, communication, planning, organizing, and assembling, reasoning, problem-solving, decision-making, and judgment, controlling impulses and desires, and being patient.
Assuming Healing Heroes House VRF meets its desired goals and outcomes, we will extend services to a larger geographical area. We will also advocate on behalf of service members to improve personal protective equipment during combat deployments. And finally, we will provide on-site vocational training that would encourage service members to be productive members of society. Life after rehabilitation.
This concludes our presentation. Thank you.
Hey, There he posed, the cousin from the back. What did I say?
For murderers.
I said propose, but Persa.
Okay.
Christian, right? You guys.
I said I'm not. She's laughing. And I was like, okay, I can hear her really. I wasn't listening to you. Your phone went off. Okay. Take two.
Oh my god. One, two, smile.
That was good. We needed that laugh.
That was good, girl. That was good.
Oh, it's still good.